As a healthcare provider, there are a wide range of services that you provide to your patients, from office visits to services, but a patient-centered care plan is something that you really should consider. You might have heard this term before, but let's dive into exactly what a patient-centered care plan entails. Hi everyone, this is Dan from ThoroughCare. At ThoroughCare, we're most known for our patient-centered care plans in our software. You might have done care plans with your patients before, but it's really important that they are patient-centered. Medicare uses the word patient-centered care plan quite often, so it's really important to understand what they mean by that. When we're talking about a patient-centered care plan, the goal is to make it something the patient can relate to. It's one thing to give the patient a list of goals that they should work on, but it's even better if the patient can relate to those goals. In this video, we're going to talk about 5 common elements that exist in a patient-centered care plan. The first thing to consider in a patient-centered care plan is that it will allow more collaboration between the patient and their care team. When asking questions to a patient, it's important to understand what's important to them. For example, let's say that your patient has diabetes. While the doctor might create a goal to lower their A1C, the item that's important to the patient might be to reduce swelling or to decrease vision loss. So it's always important in a patient-centered care plan to ask, what diabetes goal is important to you? Or which barrier should we resolve? Or which intervention should we work on? We found that this keeps the patient more engaged over time, and it really allows you to track the patient's progress and keep their interest as you go through the care plan. Another factor to consider is that the care plan focus on both the physical and the emotional parts of the patient health. For example, you could create goals for the patient to have a certain test or to make sure ADLs are managed effectively. But you also need to take into account the emotional impact as well. Would the patient have anxiety related to any of these? Would there be worry? Would this create trouble with any family members? It is important that you do consider both aspects when creating a care plan. Along those lines, it's important to include family and friends as a part of the care plan. Having a reliable support system is the key to your patients succeeding. For example, if they have a certain chronic condition, who can they go to when they have a health-related issue? Who can help them if they're going to miss an appointment that might be able to take them? Or who can they go to if anything comes up other than their care team? It's really important that this be considered when creating a patient-centered care plan. It's also important that patient-centered care continues outside of the office. It's one thing for the patient to agree with everything when they're in the clinic and in front of the provider or care team, but the real challenge is when the patient goes home. They should have a list of things that they focus on every day that the patient both understands and can relate to. It's also important to check in with the patient periodically, maybe every few days or weekly or even several times a month. A program like Chronic Care Management is great for patient-centered care plans because providers can use the time they check in to make sure the care plan is on track. It's important that the family members are bought into that care plan too. They should know the items that the patient is focusing on. For example, if the doctor and care team want them to lose weight, it's important that the support system and the relatives and the friends are aware of that too. And finally, the best part about a patient-centered care plan is patients will have more access to their care and they'll have a better understanding of why it's important. It really is critical that the patient is bought in. The reason you're doing this care plan is to manage this chronic condition. Managing this chronic condition will keep you out of the hospital or even decrease your chance of a serious issue or even death. If the patient is bought into why it's important, their odds of following through with the care plan are greatly increased. It's important that the patient understands that if they have any questions or need more information, that they can go to the care team. The provider should also make themselves available if the patient does have any questions that the care team is unable to answer. If the patients understand the results and the expected outcomes that will happen, the odds of this being a successful care plan are greatly increased. So please encourage your patients to be bought into the care plan. That's what we see as the most important factor that determines their success. As you can see, for this to be successful, patients must be partnered with their care teams. If you've done care plans before, but maybe you just gave the patient a list of things to work on and it wasn't patient-centered, that's okay. You can build upon that and follow up with the patient and ask them more of these patient-centered types of questions. It's never too late to start that. So now that you know what a patient-centered care plan is, let's talk about why it's important and what the benefits are for both patients and providers. Check out the next video in our series to learn why it's important for patients and providers. If this video was helpful to you, please be sure to like it below. And if you have any comments, please list them below. This is Dan with ThoroughCare. Thanks for watching.